Noonan syndrome is a genetic disorder that prevents normal development in various parts of the body. If you've heard of Turner syndrome, then you are probably familiar with Noonans, as they are very similar. Noonans is something you are born with. It doesn't just happen overnight. A person's face is usually a key factor in the detection of Noonans. Generally, in early infancy, you can find such distinguishing features such as wide-set and down-slanting eyes, low-set ears, a deep groove and wide peaks in the upper lip, a short neck, and a low hairline on the back of the head. Other features that happen to be on those affected include widely spaced eyes, poor alignment of teeth, a small lower jaw, and sometimes no eyebrows. Not all symptoms are visual though. About 80% of people with Noonan syndrome have congenital heart disease, accounting for some of the key signs and symptoms in Noonans. In more detail, the problems with their heart that they may have include the narrowing of the pulmonary valve or an abnormal thickening of the heart muscle. Other structural defects include having a hole in their heart, which 1 in 5 people have even if they don't have Noonans. There are many more symptoms in Noonans, including an unusually shaped chest, learning disabilities, multiple eye problems, abnormal bleeding, lymphatic problems, and undescended testes. The cause of Noonan syndrome is a mutation in a particular gene. Currently, scientists know of 7 genes that can cause Noonan syndrome. The mutation can be inherited from a parent who carries a defective gene, or it can develop because of a new mutation in children who don't have a genetic predisposition for the disease. Children who have one parent with Noonan syndrome have a 50% chance of having the disorder. Defects in these 7 genes cause them to produce proteins that are continually active. Because these genes play a role in the formation of many tissues throughout the body, this constant activation of the proteins disrupts the normal process of cell growth and division. In some people, none of the 7 genes has a mutation, which may mean that some other, still undiscovered genes can cause Noonans. Despite identification of 7 causative genes, the diagnosis of Noonan syndrome is still based on clinical features. In other words, it is made when a physician feels that a patient has enough of the features to warrant a label indicating association. An absence of a mutation will not exclude the diagnosis, as there are more yet undiscovered genes that cause Noonans. Molecular genetic testing may help make a diagnosis. If there's evidence of heart problems, the doctor will likely recommend an electrocardiogram or an echocardiogram. An electrocardiogram involves placing electrodes on your chest. An ECG records the electrical impulses that travel through your heart to assess problems. An echocardiogram uses sound waves to create a moving image of your heart working so that the doctor can see where there may be problems. Currently, there is no cure for Noonans, however there is treatment available. Treatment for individuals who have Noonan syndrome is based on their particular symptoms. Heart problems are treated in the same way as they are for individuals in the general population. Early intervention programs are used to help with developmental disabilities when present. Bleeding problems that can be present in Noonan syndrome may have a variety of causes and are treated according to their cause. Growth problems may be caused by lack of growth hormone and may be treated with a growth hormone treatment or basically steroids. Having Noonans does not change your life expectancy. Noonans is something that you will have for the rest of your life. Visually, there is not too much that can be done to people with Noonans. However, internally, some problems can be fixed, generally by surgery.